The first thing we want to do in treatment is provide medical stability to make sure that their physiology, that their heart, that their organs are functioning properly, and help them regain enough weight so they don't die. We have to keep them safe. So one form of treatment is hospitalization, and there are criteria in which a child needs to go into the hospital. This is largely determined by her weight, by her what we call vital signs, her pulse, her heart rate, and her blood chemistry. Once we provide medical stability, then we can move to other forms of treatment that are psychological and also social. These girls are obsessed with weight and thinness, but actually there are a lot of difficulties that they have in terms of their own sense of self, their relationships with their family members, with peers, and their sense of self-esteem, which is generally quite low, even though most are very, very bright, talented, creative, and high achievers. And when you view them from the outside, it seems as though everything is perfect. Family therapy is really crucial in eating disorders. Let me point out first, though, that these are the most loving, dutiful, loyal, and devoted parents in the world. I mean, I take care of many of them. The problem is that there are processes that go beyond anyone's recognition. For example, a focus on thinness, on perfectionism, on image, emphasis on weight-restricting sports like gymnastics, ballet, figure skating, long-distance running. While these may seem fine, and in many families they're fine, they may inadvertently play into a girl that has an eating disorder, and family therapy has to look at the values, the ideals that the family is promoting, but also look at their relationships, because there may be relationships either between the parents or the parent and the child that are a little out of whack and that need to be put into perspective. The ideal of family therapy is to take the pressure off of the child as the identified patient, as it were, and for the family to see that as a system, this is our problem. And once ownership is taken and we're all a part of the problem and the solution, then we're in business. As one recovered anorectic told me, what we learned from family therapy is that everyone and no one was to blame.